Welcome to This Explainer. Today, we're zeroing in on a topic that is honestly a massive source of anxiety for so many families: the true financial realities of seeking addiction treatment in Florida. It's a subject that carries a ton of weight, both emotionally and financially. Navigating rehab is tough enough, right? You really don't need the added stress of unknown costs hanging over your head. So we're going to break down exactly what you're paying for, how much it can actually run you, and most importantly, how to safely navigate the financial side of recovery.
Okay, let's dive right into this. 103. That is the sheer number of Florida treatment facilities currently listed in the Rehab Cost Directory. It's a huge number. And this incredible volume of choices makes Florida a dense, highly competitive market, which, believe it or not, actually helps keep prices in check. So that's the good news. But the challenging part? Having over 100 options can feel incredibly overwhelming when you're just trying to figure out where to get help without completely draining your life savings.
Which brings us to a quote from our source material that really hits the nail on the head. Florida is one of the country's biggest treatment destinations. Choosing carefully matters more here than almost anywhere. The stakes here are incredibly high, both financially and medically. South Florida, in particular, is packed with programs of wildly varying quality. You literally have world-class clinical care sitting right next door to facilities that offer a terrible return on your investment. So today, we're going to act as your cost-conscious navigator to make sure you get the absolute best clinical outcome for your money.
Here's our roadmap for today. We'll cover the Florida rehab landscape, decoding rehab costs, high acuity and premium care, accessible and broad coverage, avoiding placement scams, and finally, concrete next steps for treatment.
Part 1. The Florida Rehab Landscape. Dense hubs and varying quality. Section 2. Decoding rehab costs. What does treatment actually cost?
$800 to $1,000. Now that's not a monthly rent payment, that is a daily rate. Specifically, Boca Recovery Center in Pompano Beach publishes these rates for their higher levels of care. We really need to ground ourselves in this financial reality. If you multiply that by a standard 30-day stay, yeah, you're looking at a $24,000 to $30,000 financial investment. That's a lot of money, but it is absolutely vital to understand exactly what that money is doing for you.
Now, what's really interesting here is how directly your required level of medical acuity and amenities drives that daily rate. Like, what actually necessitates that massive price tag? Well, it comes down to intensity. Higher levels of care, things like medical detox, residential and inpatient care, they require round-the-clock medical supervision, housing, and highly intensive resources. But notice the lower tiers. Step-down levels of care, like outpatient programs, telehealth, or intensive outpatient programs, cost substantially less. Figuring out the exact level of care you clinically need is basically step 1 in managing your rehab costs efficiently.
Section 3. High acuity and premium care. What are you paying for at the top tier?
The Florida market is honestly a study in contrasts. On one side, you have premium facilities like Coastal Detox and Stewart, commanding higher costs for an executive track designed specifically for working professionals. We're talking private suites, dedicated workspaces you can actually keep your laptop and phone, chef-prepared meals, and bedside nursing. But on the flip side, you have Agape Detox Center in Port St. Lucie. They still offer a gorgeous resort-like setting, but their structure focuses on high financial accessibility. They accept Medicaid and Medicare. It's fascinating how cost and accessibility scale depending on the specific amenities and the insurance a facility accepts.
So what does a premium price tag actually buy you medically speaking, not just in terms of luxury? Well, at the Haven Detox in West Palm Beach, it buys you intense 24/7 hospital-level monitoring for severe cases, which is a massive cost driver. At FHE Health in Deerfield Beach, you're paying for advanced neuro-rehab tech like QEEG brain mapping, neurofeedback, and TMS. And then Recreate Life Counseling in Boynton Beach pairs upscale amenities with highly credentialed, Joint Commission-accredited therapies like CBT and DBT. The big takeaway? Top-tier pricing isn't just about high thread count sheets. You're paying a premium for highly specialized, intensive clinical oversight.
But hey, it isn't all just brain mapping and hospital monitors. I absolutely love this detail from our source. Down at Beach's Recovery in Jacksonville Beach, right alongside their highly clinical EMDR and equine-assisted therapies, they have Tallulah. She's the on-site therapy dog in charge of handling morale. It's just a really great reminder that even within highly structured, costly clinical programs, there's often a very welcoming, holistic, and, well, deeply canine touch to the healing process.
Section 4. Accessible and broad coverage. High-quality care within reach. Getting excellent care doesn't always mean you have to drain your savings. The facilities here prioritize broad payer mixes, making care dramatically more affordable for everyday people. Boca Recovery in Pompano Beach accepts Medicaid and Medicare, which is just huge for lowering those out-of-pocket expenses. Zinnia Health in Miami accepts a really wide range of insurers, including Ambetter and Anthem. Banyan Gulf Breeze does something geographically vital. It brings a full continuum of care and major network acceptance up to the Florida Panhandle, an area that historically has fewer cost-effective options than South Florida. And Clean Recovery over in Tampa anchors the Gulf Coast with broad network acceptance and a really strong emphasis on trauma therapy.
If you take away anything at all today regarding your wallet, let it be these facts. First, federal parity law ensures that most health plans actually must cover addiction treatment. The facilities we just highlighted collectively accept major carriers. We're talking Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, Humana, and Better. And utilizing Medicaid or Medicare can literally bring your out-of-pocket costs down dramatically. But, and this is absolutely crucial, you have to actively protect yourself. Always confirm network status directly with both the facility and your insurance provider, and make sure you verify any pre-authorization requirements before you admit. The market's competitive, which works in your favor, but you have to be your own financial advocate.
Section 5. Avoiding placement scams, protecting your wallet and your recovery.
So the most crucial point here is this. Patient brokering is a felony in Florida. This is arguably the single most important financial and safety warning we can give you today. In a market this dense, bad actors definitely exist. If a third-party placement service tries to pressure you, or if anyone offers you free treatment, cash, or free flights just for choosing a specific facility, you need to walk away immediately. It's illegal, it's predatory, and frankly, it puts both your finances and your recovery at serious risk.
So how do you actually protect yourself? It comes down to 3 very simple, actionable steps. Number 1, always verify that the facility is actively licensed by the Florida Department of Children and Families, or DCF. Number 2, skip the third-party middleman entirely. Just call the facility directly using the phone number listed on their own official website. And number 3, like we just said, absolutely reject any sketchy offers for free flights, cash, or any high-pressure sales tactics. Securing safe, legitimate care means verifying the facts yourself.
Section 6. Next steps for treatment, taking action with confidence.
Okay, so we've covered the high daily costs, the varying levels of care, and exactly how to dodge those financial predators. Now, how do you put this into action? The source material highly recommends using comprehensive directories, like Rehab Cost, to actively filter your options by city and by your specific insurance. Definitely use their free treatment cost calculator. It's hands down your best tool for getting a personalized estimate of out-of-pocket costs before you commit to anything. And please, keep these numbers handy. The SAMHSA National Helpline at 1-800-662-4357 is free, totally confidential, and open 24/7. And if you or a loved one are ever in an immediate crisis, dial 988 for the Suicide and Crisis Lifeline.
I want to leave you with one final, absolutely vital question. Do you actually know what your insurance covers? Honestly, don't wait until you're holding a massive bill to find out. Take a few minutes, use those cost calculators, make the phone calls directly to the facilities, and protect both your physical recovery and your financial health. Thanks so much for joining us for this explainer, and we really encourage you to take that next empowering step today.